How does histopathology define cervical cancer types? Imagine looking at a tiny piece of tissue under a powerful microscope and discovering what kind of cancer it is. That's what histopathology does for cervical cancer. It examines the cellular details of a biopsy to classify the cancer into specific types. The two main types are squamous cell carcinoma and adenocarcinoma, each originating from different types of cells in the cervix and showing unique features. Squamous cell carcinoma is the most common form, making up about 80 to 85% of cervical cancers worldwide. It starts from the flat, scale-like cells that line the outer part of the cervix, called the ectocervix. When pathologists look at tissue samples, they see cells that may produce keratin, a protein, which helps distinguish different subtypes. These cancers often develop from precancerous changes, called cervical intraepithelial neoplasia, or squamous intraepithelial lesions. These lesions are graded from mild to severe, indicating how close they are to becoming invasive cancer. High-risk human papillomavirus infections, especially type 16 and 18, are strongly linked to the development of squamous cell carcinoma, as the virus integrates into the cell's DNA and promotes abnormal growth. Adenocarcinoma accounts for roughly 10 to 15% of cervical cancers. It arises from the glandular cells lining the endocervical canal, which is the passage inside the cervix. And like squamous cell carcinoma, adenocarcinoma develops from precancerous lesions called adenocarcinoma in situ. These tumors can have different subtypes, including usual type adenocarcinoma, mucinous, endometrioid, and clear cell types. Many adenocarcinomas are also associated with high-risk HPV infections, but some can develop independently of the virus, which makes their behavior and diagnosis slightly different. There are also rarer types of cervical cancers, such as adenosquamous carcinoma, which contains both glandular and squamous components. Other unusual variants include glassy cell carcinoma and mucoepidermoid carcinoma, which tend to be more aggressive and have distinct microscopic features. To identify these types, pathologists use special staining techniques like hematoxylin and eosin to examine cell shape, size, and organization. They also employ immunohistochemical markers such as P16 and Ki67, which help distinguish high-grade precancerous or invasive cancers from benign changes. Testing for HPV DNA in tissue samples further supports the diagnosis, given the strong role of the virus in causing most cervical cancers. Knowing the exact type of cervical cancer is vital because it influences treatment choices and prognosis. Squamous cell carcinomas and adenocarcinomas can respond differently to therapies and tend to spread in different ways. Accurate classification helps doctors develop personalized treatment plans and decide on the best approach for each patient. In summary, histopathology defines cervical cancer types by analyzing the origin of the cells, their microscopic features, and their association with HPV. This detailed understanding guides clinicians in diagnosing, managing, and monitoring cervical cancer effectively, always emphasizing the importance of consulting healthcare professionals for individual care.